flop right back over their upper airways, and suddenly you don't have bilateral chest excursion, and you realise that it was probably because of that.
So you're giving them the two breaths at the start, and then you're checking for a response. And if you don't have a response, you give them 12, right? 12 breaths.
No, you'd be at a rate of 12 to 15 a minute.
Yeah.
I have to say that I probably go faster in all reality. And it's not going to hurt them, because just remember the FI2 they get is about 15 to 18% of them, our normal can be anything from 40 above, depending on whether they're ventilated or not. So they're only suddenly getting 15 to 18%, so they're really probably only perfusing the surface of their lungs and their brain if you're lucky, and that's if they're arrested. And so you're probably only perfusing that much of them if they've had a respiratory arrest. So you can see why respiratory arrests progress fairly rapidly with cardiac arrest if you can't reverse whatever is caused it. Any other questions?
So after the first 2 breaths, patient regains, like they have breath then, just reposition patient, do all that sort of stuff, or?
If you get to that after the 2 quick breaths and you assess them and their breathing, then you have to assess things like the rate and depth of their breathing, because it may be that they're going to slip back into a respiratory arrest and they might even have a cardiac arrest. So it's about supportive measures, so left lateral position, high flow oxygen, hopefully you've got some help by then. You may even have to support their breathing. So if you found, like I said, that they've only got a respiratory rate of 4 and they've got very shallow chest excursions, then it's not enough to ventilate and therefore perfuse their tissues if they're going to get end organ damage, aren't they? So you don't want that to happen. So you've got to provide that support, and then it may be a case of doing that until they can be intubated and sent off to intensive care or put on BiPAP. So it just depends. How do you feel? Traumatised.
There's so much, like in the advanced procedures, there's so many things to remember.
Problem because intubation, it's got a problem.
If they don't have a trachea and they desaturate and they can cough for you, get them to, if for example they come to hospital and they've got a chest infection and they have a productive cough, and you know that they've got, it doesn't matter what colour, whether it's white, yellow, green or brown, brown may probably work, blood streaked, then if they can cough, then get them to cough, and you can even do some chest physio. Hopefully they will understand the physio themselves, but if they do come to emergency and they're desaturated,